Dolly is on here, so kind of fun. We're going to start off today by going 3 different locations in Ohio, and we're partnering. First, start off. We're partnering with Primary One, a community health center in Columbus, for a drive-through vaccination clinic with vaccines being administered by our own Ohio National Guard. This is an effort to help underserved folks in underserved areas get access to vaccines. And joining us from today's clinic is Jangus Whitner, who is Primary One Health Clinic pharmacist. How you doing today?
Good, good. How are you doing?
It's a little cold out there.
Yeah, it's all right. It's all right, but that's the Ohio weather that we signed up for, so that's good.
We signed up for it. We did indeed. So how's the vaccine program going today?
Today's been very steady, and I think a lot of people out here they're interested, excited, and ready to get their shot. So it's been great.
So is this basically, are we looking at basically kind of a drive-through program here, or how's it work?
Yeah, we got a few lanes going at the same time, and we have an extra lane for those that may have extra concerns or questions that need to talk through. And that's staffed by our clinical pharmacist staff that are there and helping out answer those questions.
Okay, and you're going to do another one of these clinics, I think, on Thursday. Can you tell people how they can get vaccinated that day?
Yeah, definitely. So there should be a number at the bottom of the screen you can text the word vaccine to. And also, the Ohio Department of Health has a flyer that has our website on there that you can go on and schedule for Thursday's clinic.
Okay, and will Thursday's clinic be the same place?
Same place, yep.
And tell us exactly where you are now.
I'm at 3433 Agler Road, right in northeast of Columbus, Ohio.
I think you have Miss Winnie Taylor there, who is ready to get vaccinated.
Yes,
Miss Taylor, how are you doing today?
How you're doing? A little bit hard to hear. So she said, we talked to her earlier. She's doing well. She's excited.
All right. Well, we're going to watch you, Miss Taylor, get your vaccine. So we can go ahead and do it. We'll watch y'all.
Awesome. As you know, Governor, we're doing this in partnership with the Ohio National Guard. So we have Krista here ready to get the vaccine.
All right, feel a cold wipe, okay? Got a second to dry. There's your card. Thank you. All right, honey, little poke here, okay? 1, 2, 3. Wonderful.
Well, Miss Taylor, we want to thank you very much. We thank you. We appreciate it very much, and want to thank the Ohio National Guard for doing this. The Guard will be doing a number of other sites around the state as we move forward. They've been a tremendous help during this whole pandemic, and we want to thank Primary One Health for doing this. And we'll see some people back Thursday.
Thank you, Governor. Yes, thank you.
Thank you. We're going to go to Mansfield now, where David Finley is going to be vaccinated. With us is Brian Galuzny, Chief Pharmacist of Mansfield Discount Drug Mart. Brian, your location, I think, is one of 76 Discount Drug Mart locations in Ohio taking appointments. How do people sign up to get an appointment from you all?
That is correct, Governor. Hey, and good afternoon to you. To sign up for the vaccine, basically just go to our website, which is discount-drugmart.com/COVID. If they are having any trouble whatsoever with the website, they can always call any of our locations, and our hardworking staff will be more than happy to assist anyone who's interested in registering. So,
and I think you've got Mr. Finley. Is that right, Mr. Finley?
Yes.
Well, thank you very, very much for coming. Are you ready to get your vaccine today?
I'm all set.
You're all set. All right, we'll watch you if that's okay.
Very good. All right. That was fast.
Doing okay, Mr. Finley?
Very good. Yeah, no big deal.
Okay. Well, we want to thank both of you very, very much and have a great day. We appreciate it.
Thank you, Governor.
Thank you. Thank you. We're now going to Dayton, where Montgomery County Board of Developmental Disability Services partnering with a local pharmacy partner, and that is Zeke's Family Pharmacy, and also partnering with Mount Enon Missionary Baptist Church to vaccinate people with intellectual or developmental disabilities and certain medical conditions in a large clinic. We have Superintendent Pamela Combs, who is with us. Superintendent, how are you doing?
I'm doing great today, Governor. It's an honor to be with you from Dayton.
Well, you have a good partnership going. Tell us a little bit about the players in that partnership and how this is working.
Yes, our Montgomery County Board of Developmental Disabilities is partnering with Zeke's Family Pharmacy to provide those much needed vaccinations to those that we serve in Montgomery County. We serve over 5,000 people with developmental disabilities, and as you know, they're among the most vulnerable. And we're here today at Mount Enon Missionary Baptist Church, and they've opened up their church home for us so that we can just have an inviting place for those that we serve to come to.
Well, we appreciate them doing that very, very much. That makes a big difference. I know pharmacist Gregor Graylock is ready to administer the vaccine.
Yes, and Governor, I just really quick want to thank you for thinking of those with developmental disabilities, and our director, Jeff Davis at DODD. We just appreciate all the collaboration with the Department of Health and our local Board of Health to get all of this done. Thank you so much.
Well, thank you very much. And we have Kevin Davis. Mr. Davis, how are you doing?
Good. How are you doing?
I am well. I understand you're a student at Wright State. Is that correct?
Yes, that is correct.
And what's your major? What area are you studying?
I am majoring accountancy.
Very good. You ready for the vaccine?
Yes, I am ready.
All right. Well, we're gonna watch you then. That's okay. We
All
appreciate
right.
it.
Here we go.
Here we go.
All righty.
How you doing, Kevin?
I'm doing good.
That wasn't too bad, was it?
No, it
All
wasn't.
right. Well, we appreciate you all being on here today. Going okay? Everything going all right today?
Yes.
Okay.
Yes.
Yes,
Governor.
very good.
It's going good.
All right. Well, we like the partnership. Thank you. Thanks for doing this, for everybody doing it. Appreciate the church doing it and all of you doing it. Zeke's Pharmacy, thank you. Thank you all very much. Appreciate it.
Thank you, Governor.
Thank
you.
you, Governor.
Well, this week, starting yesterday, we're vaccinating people 75 years of age or older, and also a small group who we've defined this group before, but it's a relatively small group who have congenital, early onset, or inherited medical conditions, and for the next several weeks, the and, it's important, are people with developmental or intellectual disabilities. Local boards are now reaching out to those individuals. So you don't have to call. Local boards will be reaching out and have already started to reach out to those individuals. So these are the groups that we're vaccinating this week. I have some good news as far as the number of shots this week, the number of doses of vaccine that will be available to our older Ohioans. And if you recall, we've talked about this, that at least as far as we can see out, it's going to run roughly 100,000 a week that we're going to be able to designate and devote for those Ohioans who are older Ohioans. Again, this week it's 75 and older. And next week it'll be 70 and older, and the week after that 65 and older, and then we'll hold right there at 65 because we know that that is a very large group from 65 up. And it's going to take a number of weeks to be able to cover everyone in that age group that wants it. But I want to talk a little bit about how we have some extra doses this week, more than the 100,000. We have been averaging about, and it does vary some, and there's no guarantee from week to week where it's going to be, but we've been averaging about 146,000 doses, split evenly between Moderna and Pfizer that are coming in as far as first doses that are coming into Ohio every week. We won't talk about the second doses, it just confuses it, but the second doses are following up, and we've seen no problem with that. But 146,000. In past, for example, last week, we had more go to the 1A group. This is 1B. But we're starting to finish up the 1A group, and some counties have totally finished up the 1A group. So what that means is that of that 146,000, more than 100,000 this week and next week we'll be able to devote to the older Ohioans and the Ohioans who fall into that category. Now it will vary somewhere between 100 to 110, 120,000. The weeks will be different, but that's how it will vary. So you'll have an uptick from that 100,000 for that because we're simply getting more, putting more focus on, we're able to put more focus on those who are older Ohioans, who we know bear the gravest risks, the most important risk, because we're finishing up the 1A. When we get very far into it, another week though, we're going to start drawing down, and some of it's going to have to be devoted to people who teach in our schools, who work in our schools. So this is a kind of a 1 week uptick there. We have a 2 week uptick though that's also significant, and I want to talk briefly about how this really came about. At the beginning of this whole process, the federal government required us, if we wanted to be in the program, to really focus on nursing homes, and we did. And I'll talk about that a little later, why that was so very, very important. What they required us to do is really set aside effectively 353,000 vaccines that would eventually go into these congregate care settings. And they were just set aside. And as we go week to week, our pharmacy partners who are going into our nursing homes, who are going into our congregate care settings, draw that down. It's like a bank. They draw this down. But we were required to put that in that bank at the very, very beginning. Well, as we went on, it's become clear that not everybody in the nursing homes is going to take the vaccine, not every staff member. And we really knew that, of course, going in. We didn't know what those numbers were going to be or how that was going to play out. So I got to thinking last week, what the federal government had said was, when the whole pharmacy program is over, when you're done with all your congregate care settings, we'll give you back what we haven't used. And that was supposed to be at the end of March. And so I got thinking last week, we urgently need these. So I went to General Perna, got on the phone, and said, look, we know we're not drawing down these. We're not going to draw the entire number down because we're only running a 45% or so, 50% at the most of our staff that's taking these. And yet we'd set enough aside, because they required us to, for 100% of that and 100% of the residents. So I said, look, can't we draw some of these back now? Why do we have to wait until the end of March? And so they said yes. And so that's really, excellent news for us as we move forward. So we're going to have another 77,000 spread over 2 weeks. So very happy about that. 38,500 this week, 38,500 next week. And those we will be able to devote and have already devoted, and we'll devote next week, that extra 38,500 to our older Ohioans. Just very, very important that we move as quickly in that area as we can. But I just wanted to take a minute to explain how these numbers work and how we were able to pull this number down when, frankly, we didn't think we were going to get these back until the end of March. So happy that they were flexible and happy to be able to get these back. Let me talk for a moment about our our congregate care settings and why we have set these up as such a priority. The reason is, this is, as we've said, this is where we've seen the most deaths. Over 50% of the deaths in Ohio have come out of our nursing homes. And why is that? Why are congregate care settings, are people so vulnerable? Number one, you have the individuals who are there generally have a medical problem, and they certainly almost always, not always, but almost always, are over 65 years of age, and they have a medical problem. Also, they're living in a congregate care setting. They're living in close proximity to each other, and we know the nature of this virus is that it spreads very, very, very quickly. So we really put a focus on these nursing homes. We have 953 nursing homes in the state of Ohio. First dose, as I said, pretty much done. Second, we are actually second in the nation for number of people vaccinated in nursing homes. We have a lot of people in nursing homes. We've really concentrated on it. We're now in the process of going back for the second dose. And, we're happy that to be able to, have those done. Assisted living, we started on assisted living, another congregate care setting where the risk is high. We're well into those as well. But let me mention several others that I don't think we've really talked about. And we decided we want to do these early on, again, because of the grave risk that these individuals have. State-run developmental centers, our state-run developmental centers. We're very happy. 89% of the residents there have taken the shots, the first vaccine. 89%. We're very happy about that. 531 people that constitutes. Our state-run psychiatric hospitals, 73% of long-term patients have now been vaccinated. So we've gone through all of these state-run psychiatric hospitals. Our state-run veterans homes, I did mention this before, 92% at our two veterans homes in Sandusky and Georgetown, 92% of our veterans who are residents there took the vaccine. Again, another group. And a final group I'd like to talk about is people with developmental disabilities who are not in state-run facilities. They're just out in the community, living in communities. Again, we've been able to vaccinate so far, 5,500 vaccinated so far. We continue to work on these individuals as far as getting them vaccinated and reaching them. And this is the effort that's being made primarily by our local health departments. And our local health departments are really doing a very good job in this area. Butler County, for example, covered all of those individuals in their county with developmental disabilities and mental health, as well as mental health. And that they covered, actually, Butler County, if you can believe this, covered 250 separate locations. So hats off to Butler County. Thank you very, very much. Muskingum County has done a great job in this as well. A smaller county, but they've covered 50 separate developmental disability facilities in Muskingum County. Let me update everyone now in regard to vaccines in our schools. A couple things to keep in mind. One, we continue to have the scarcity of the vaccines. That's not going away, at least in the immediate future. We hope eventually it goes away. And so what we have to do as we go forward is we balance the group we've been talking about, our older Ohioans, because we know that they're gravely at risk. At the same time, we want to allot enough of these vaccines to get all our kids in school by March 1. We want every kid back in Ohio back in school by March 1. Why? Because we know that some kids don't do very well remotely. We have some children in the state of Ohio who have been remote since March. So it's been basically a whole year. Some have been remote for the great bulk of that time period. We want to give every school that opportunity to go back in. 98% of our public schools, and we're not only talking about vaccines for public schools, we're talking about our charter schools, which of course are public schools, but also our parochial schools, other private schools. We're treating them all, of course, the same as we should. So this is where we are. We will start vaccinating. Actually, we gave you the date of February 1. We're going to move that up a little bit. We're starting in Cincinnati the latter part of this week, I think on Thursday. We will start there, and we will continue to go through. Not every school will be able to be started on February 1. We do not have enough vaccine. We have to take it as we get it in week after week. But we have plans for everybody in any school in Ohio who works there, who wants a shot. Our goal is for them to be able to get the first shot in the month of February. We will see some of those individuals and some of those schools who will be able to get the second shot in February as well. So it's kind of it's going to be a rolling start. The schools that will start next week, the schools that will start have already been told they will start. So they should know that and should have been notified by now. The rest of the schools, the rest of you who are wondering when you will start, you should know by Friday. We will indicate to you by Friday, when your time, what your week will be for your personnel to be able to get vaccinated. Each school, as we've announced before, will have a vaccine provider. It might be a health department, it might be a pharmacy, it might be an urgent care, I think in a couple of cases. We will make sure that everybody has a partner by this Friday. Some of you have picked your partners, and that's fine. Some of you didn't pick a partner, and we will be able to assign a partner to you. Again, the goal, every kid back in school by March 1. Every school personnel will be able to get their first vaccine. Our goal is first vaccine this month. Some of you will be able to get your second vaccine this month as well. Eric, let's go to our data slide. And we'll first of all start with our kind of a regular slide. And we've seen something, very, very good in the last week or so. And I know those of you who watch these numbers have been watching it. We'll start with our cases. 42, 62, we've seen these cases come down. Now that's still a very high number. And there are different points of this pandemic, we would have said, oh, that's horrible. Everything's relative. When we were looking at 8,000 and now we're looking at 4,200, obviously that's much better. And you can see the graph here, it's gone down some. The deaths, 88 above the 21-day average. Same way with hospitalizations and same way with ICU admissions. So all of those are lagging indicators and they are higher than what it's been. But on cases, at least, this number has been a pretty good number. Let's go to our hospital situation. Eric, if you have that slide yet. This is something we look at every single day, and we do it in cooperation with the Ohio Hospital Association and every hospital in the state of Ohio. And what we look at is how many patients are in the hospital who are COVID patients every single day. And what we have seen is a pretty decent drop in the last week or so. And today as you can see, we get an additional drop. We went up a little bit yesterday and then down again today. But the trend line is certainly in the right direction. 2,964 Ohioans as of yesterday who have COVID are in the hospital. That brings me to a discussion about the curfew. Many have asked when the curfew comes off. And many have said, if you just would give us a way to measure, give us a goal, tell us at what point we will be able to take a curfew off in the state of Ohio. And so we're going to do that today. As I said, again, we've seen cases come down, which is good. That's a good indicator that we're headed, at least for a while, in the right direction. Eric, let's look at the other slide again, if we could. Again, this is a better number. Now, it's still high, and Dr. Vanderhoff will tell you that's significantly higher than what flu would be, 3 or 4 times what flu would be. But compared to where we have been, it's a better number, and it would appear to be an improving number. Again, I want to, before I announce what we're going to do with the curfew, I want a caution. Virus, the one thing we've learned about this virus is it's extremely unpredictable. We don't know where it's going to go. We do have the new variant, the Ohio variant or the Midwest variant that Dr. Vanderhoff has talked about. And one of the things that we are concerned about is if it does become the dominant strain in Ohio. The UK strain took, I guess, about 2 months to become the dominant strain. This strain's been in Ohio a little while. If it becomes the dominant strain, the grave concern is that it appears to be much more contagious than what we're dealing with today. So again, a caution. Another caution, we have to keep doing what we're doing. We're improving things. We're improving them because of what you're doing and what you're not doing. This didn't happen just by chance. This has happened because we have better than 90% of people who are wearing masks in retail establishments every single day across Ohio. And we have inspectors out. We know what the numbers are. So those numbers remain high. I think people are being more careful, and we're seeing our cases come down. But we have to continue to do that. We have to continue to play ball. We have to continue to stay focused on it. So with these cautions, here's what we're going to do. If we have 7 straight days where our hospitalization number from COVID is below 3,500, as you can see, I think we've had now 5 days. 1, 2, 3, 4, 5, 6 days. We're in our 6th day. So this should continue. We hope this is going to continue. And so we should be able to announce on Thursday. And what we've mapped this out, 7 days, straight days, below 3,500, we'll go to 11 p.m. curfew. And we'll keep that curfew, our plan will be at least, to keep that curfew for 2 weeks. If we go for 7 straight days below 3,000, if we get this number down below the 3,000, people keep that for 2 weeks, and 7 days below 2,500, there'll be no curfew. Now, I'm going to go to Dr. Vanderhoff. I want to make sure I've got this right. Make sure my notes are right, Doctor. And you can kind of tell us how you came up with this plan. And again, make any corrections in this. I wrote this down pretty quick after you and I have been talking about this for a few days. But I'll turn it over to you, and you can correct me on the numbers if they're wrong.
Thank you very much, Governor. Well, as we've indicated in the past, hospital utilization across our state really is one of our most reliable indicators of how severe COVID is at that time. When people are sick enough with COVID to be in the hospital in high numbers, we know we are facing a very serious situation. So as we consider easing our current curfew, it just made sense to look at our daily report of concurrent hospital utilization by COVID patients. Now, when our COVID hospitalizations, as the governor noted, are above 2,500, now remember, that's 3 times our peak census during a typical flu season. Our hospitals are facing volumes that really strain their ability to deliver other care, especially things like routine diagnostic and procedural care. They do it, but it's under a lot of strain. When they get above 3,500, which as the governor indicated, we were at just several days ago, we know they face very high demand, and responses like local and regional diversions and the need for more transfers become much more common. Therefore, we're confident that if our hospital utilization across the state drops below 3,500 for 7 consecutive days, which, as the governor pointed out, it's done now for several days, we believe we can safely shorten our curfew for the following 2 weeks to the 11 p.m. Time that he noted. If hospital utilization were to subsequently drop even further below 3,000 for 7 consecutive days, it appears that we could safely move to a midnight curfew for a 2-week period. And if it drops below 2,500, again, that's about 3 times the volume that we would see at the peak of a typical flu season. If it drops below that for 7 days, we feel confident that we could lift that curfew. Now, it's important to remember that, as the governor noted, hospitalizations are a bit of a lagging indicator, which means that if they go back up, we would likely have to respond quickly to reinstitute the appropriate level of measure, because it would be telling us we were already in that circumstance. This is not a predictive measure, it's a lagging measure. So we just have to bear that in mind. Governor, I'll turn it back to you.
Well, Dr. Vanderhoff, we'll keep it with you for a minute because I'm going to throw it right back to you. Let's talk for a moment. One of the happy surprises has been that with Pfizer, we have seen nurses, people who are given the shots, sometimes have been able to get 6 doses out of what we thought was going to be 5. And in some rare cases, they got 7. So obviously, we want everyone out there to do everything they can to maximize this. And as you're drawing this out, what should be 5, or at least what was labeled we thought was 5, if you can get 6, we want you to get 6. And I want to have Dr. Vanderhoff kind of talk a little bit about maybe what's involved here, whether it's a technique or how do we up those? I mean, obviously, doctor, if we get 6 out instead of 5, we're up 20%, at least with the Pfizer. So we're pretty happy about that, but we want to make sure everybody who's taking that, putting that vaccine out is mindful of that. So I'll turn it back to you.
Certainly, Governor. Thank you. Well, as you pointed out, it's clearly important to get every available dose of these COVID vaccines into the arms of willing recipients in Ohio. And as you noted, in many instances, we know that a vial of that Pfizer vaccine can, in fact, provide not 5, but 6 vaccine doses. And some vaccine providers have been very successful with this, and they've been able to extract a 6th dose as much as 90% of the time. But getting that 6th dose of vaccine isn't just a matter of technique, that's certainly important, but it's also a matter of having the right supplies. And these supplies have been in very limited availability nationally. Now, the key to getting that 6th dose is having access to syringes with low or 0 dead volume, 0 wasted volume. And when clinically appropriate, matching those with a 1-inch vaccine needle. Now, that's fairly technical, but providers know what I'm talking about. The good news is that Ohio vaccine providers have been leading the way in finding ways to maximize these Pfizer vaccine doses. And we've surveyed the best practices across our state and determined that it is possible to reliably get that 6th dose using a hybrid model, which uses traditional syringes for 3 or 4 of the doses, and the less readily available low dead volume or low wasted space syringes for the remaining 2 to 3 doses. And this approach conserves limited special syringe supply and gets the job done. So we also learned some good news today. We learned that our federal partners have made similar observations and will be moving in concert with us to support this approach. So armed with all of this new knowledge, we'll be working, Governor, with vaccine providers across the state to share this information and to provide them with further guidance so that they can be successful with getting that 6th dose out.
Great. So we'll be sending something out. We'll be posting something in the next few days. And again, for everybody who is putting those shots in arms out there, when you've got Pfizer, if you can get that up to 6, it will make a huge, huge difference. And I know even in some cases somebody has told me they got 7. But if Dr. Van Hoff, if people can get 90% of the time get 6, that's a big boost when we're dealing with a very scarce commodity. So we can save lives by doing this. So thank you very much. Throughout this vaccination process, our goal will be to make sure every Ohioan has access. We know there's not enough. We know that everybody who's trying to get it this week is not going to get it. Everyone who is 75 and over, but we're going to continue to do what we can to get more vaccine out. At the same time, we have an obligation to make sure we get underserved populations and that there is equity, that there is fairness in regard to this. And so this is an ongoing process. We will start February 8th. Be taking the vaccines directly into affordable senior housing locations. And this is just one of the things that we were planning on doing, but I wanted to announce it today. We picked that date because that's the first date that 65-year-olds and older can get it, that down to that group. And we wanted to be able to go into these settings and have the majority of people at least be able to be eligible to get the vaccine. If we went in today, we'd have a lot of people who would not be able to get it. So we just thought it made sense to aim for that date to start that. This type of senior housing is home to thousands of our fellow Ohioans across the state. These homes are often residential clusters, apartment buildings ranging in units from 20 to 100, 200, 300, and even more. The threat of serious illness and death from COVID is high in affordable senior housing settings due to the age of the residents, the ease of spread in clustered housing complexes, the isolation of many residents who may not have access to information about how to get the vaccine, and potential barriers to accessing the vaccine. Our team is concentrating efforts to get these residents vaccinated and is working with local partners to offer assistance through on-site clinics. These clinics will help ease the burden for many seniors having trouble navigating the registration process and arranging transportation. In advance of a clinic day, we will provide an on-site clinic resource guide with materials to educate residents about the vaccine, advertise the clinic day, sign the individual up for appointments for that clinic. In addition to these upcoming senior housing clinics, we have intentionally distributed vaccine to providers in every county in Ohio. So every Ohioan will have the opportunity to get vaccinated close to home. Again, we've started with over 700. As we get more vaccines, that could go up to as high as 2,200 because we've had 2,200 that have signed up. And we have a variety of communication and education strategies aimed at minority communities, including upcoming town halls, paid and earned media, and a toolkit for our community partners to address vaccine hesitancy in their networks. We anticipate the National Guard is going to be involved certainly in some of this. We also, as we saw today, look forward to partnerships with churches as another way to reach out and make sure that we're covering everyone in the state of Ohio, and that no matter where you live, no matter who you are, you're going to have access. So it's an ongoing effort. We're not there yet, but it is what we're going to strive for, what we continue to strive for. And I just wanted to mention a couple of these things that we will be doing starting in a couple of weeks. Lieutenant Governor.
Thank you, Governor. I know that during our news conferences, I like to highlight what Ohio businesses are doing to help us win the fight against COVID. And you might see here, I have gloves on today. It's not because through cost-cutting measures, I've turned the heat off in my office. It's because we're highlighting Sterling ultra cold freezers. Okay, you see this one sitting right here. These are made in Athens, Ohio. These are a vital component of the vaccine supply chain. They keep them, they keep the vaccine super cold. They've been part of the UPS model, the models of healthcare that Walgreens and other types of pharmacies are using. These are portable storage for both Moderna and Pfizer vaccines. They're cold enough to serve both. This freezer can hold 1,400 vials of Pfizer, which is up to 8,400 doses or more, as you highlighted earlier. And then it can hold 540 vials of Moderna, up to 5,400 doses. And this freezer right here is at negative 71 degrees Celsius. That's negative 95.8 degrees Fahrenheit. That's why I have the gloves, because I'm going to open it up and show you what it looks like. So you open the lid here, and then you have this styrofoam insulation pack, and then the case that holds the vaccine vials. And it's turned around here. It's a little easier to reach this way. These, they hold them, sit them down here. They hold these individual vials. These are not full. They're examples. But this is super cold. I can feel it all the way through these gloves right now that I have on. But this is made in Athens, Ohio, and has been an incredibly important part of the vaccine supply chain. The company is running 6 days a week, 10 hours a day, shifts to keep up with production. Their employee base has grown 30% in the last 3 months alone, now employing over 200 Ohioans. Jobs Ohio and the Ohio Development Services Agency were partners in helping them ramp up this production. They've also been big users of tech cred, which I'll mention here in a minute. We funded 24 industry credentials to help them train and staff up. I find this, they make everything from the central repositories that UPS uses to these portable models. And I do want to say that I found this pretty amazing. With all of these freezers that they've used, Sterling Ultra Cold is protecting nearly, presently, 140 million doses of COVID-19 vaccines in 155 countries in all 50 states. And this is an Athens, Ohio company, employing Ohioans and doing some great things as part of the global supply chain for protecting these vaccine doses. And I mentioned tech cred. They already have used the program to help provide 24 industry credentials. We're in another round of funding on this, which ends January 29th. So we encourage people who want to get involved in that program to go to techcred.ohio.gov. And Sterling Ultra Cold has already applied for 26 more credentials because they just have people that need to be trained to be able to keep up with production and supply. So thanks to Sterling Ultra Cold, all the people who work there, and the team effort that we see from businesses all across the state who are helping to fight the battle against COVID-19 and ultimately help us win. Thanks, Governor.
That's a great Ohio story. Thank you, John, very much. We're ready for questions.
Governor, first question today is from Randy Ludlow at the Columbus Dispatch.
Hey, Randy.
Good afternoon, Governor.
Hi, Randy.
There are reports that the Biden White House is contacting governors this afternoon and telling them they will have an additional 16% more doses beginning next week than perhaps they expected. Have you received that news yet, and can you confirm that number?
I cannot confirm that number. I think we better wait for the White House to do that.
Next question is from Jim Oddie at WHIO in Dayton.
Governor, can you talk about a backup list? Some people are worried that some of the vaccine may go to waste when you get to the end of a shift or maybe the end of the day at a vaccination clinic, and not everyone has shown up. Is there a backup list readily available so people can step up within minutes and say, I'm ready, I qualify, I can be there to take it? What's being done to protect that?
Every hospital in Ohio, every pharmacy, anyone who is administering these vaccines understands how precious they are and that they are lifesavers, and we cannot waste one dose. So what we're telling everyone is to have a backup list. When you start vaccinating that day, you need to have your backup list. You need to know how to get hold of people. If in fact you have some no-shows, people who do not show up, you need to be able to know where you're going. Now, it shouldn't be too hard because we've asked them to keep this to 1A or 1B. So they might have EMS responders. They might have anyone over the age of 65 and older. These would be the likely people that they could go to, but anybody in 1A or 1B, and we would like for them to have that list as they start so they know exactly where they're going if in fact somebody is a no-show. With the great demand that we have out here, I know most of the providers have a on-call list, people who are waiting to be called. And so being able to pull these people in during the day is certainly something that makes a lot of sense. In an emergency where they cannot find anybody in 1A or 1B, and there's, in those two categories, that's 3 million people in Ohio. But if for some reason they can't find anybody in those categories, they can certainly put this shot into anyone's arm, any adult's arm, and, we would not be wasting it. But we want to target these as much as we can. And they are precious, they are lifesavers, and we can't lose any.
Next question is from Jesse Balmert at the Cincinnati Enquirer.
Hello, Governor.
Hi, Jesse.
My question is, who is deciding which schools go first and how are they making those decisions?
This is a scheduling, by and large, a scheduling issue that I've left up to our team to schedule. We did have a request from Cincinnati schools, and we have to keep in mind what our goal is, and our goal has been to get kids in school. And they had a very specific request. Can we start a little bit? Can we start a little bit? And so we worked it out so they could start a few days earlier. We're happy to get started on this. Our goal was to start February 1. We're going to have a large number of schools throughout the state that will be in that first week and more in the second week and on and on. And we're going to continue to do everything we can to get these schools finished. Everybody in the school who may want the vaccine, and that includes not only does not include students, any adults in the building. So that would include office personnel. It would include custodian. It might include somebody in the who's fixing the food. Certainly, include the teachers. But that's what the goal is. And we're juggling. I mean, I'll be very honest. We're juggling. Trying to get enough to do that at the same time that we're moving forward on our older Ohio citizens. And we're trying to do two things at once. And, if we had more vaccine, we wouldn't be juggling quite as much, but it is what it is.
Next question is from Dan DeRose at WOIO in Cleveland.
Good afternoon, Governor.
Hey, Dan.
I want a clarification on this curfew process. Some of the numbers got a little jumbled in there. You said that
Sorry.
it could even, no, that's all right. Hey, totally understandable. That by this Thursday that we could see a possible 11 o'clock as long as we stay under that 3,500 for
Eric,
7
let's put
straight.
the other slide back up.
For 7 straight days. But then you said that it has to stick for 2 weeks. So is that the case that it has to be 11 o'clock for 2 weeks? And I mean, as of today, we're at 2,964. So we're already under the 3,000.
Right. I mean, we made this decision, latter part Friday, Saturday, we were talking about it. And so this has continued to drop, which is good. I mean, we're happy about it. What we don't want to do, and we don't want, we also are mindful that people have to plan, and the bar owners have to plan, and restaurants have to plan, and other people have to plan. So we don't want to be jerking them around with no notice. So the goal is to do it 2 weeks. In 2 weeks, we look at it again. Now, look, we may jump a whole section in 2 weeks if this thing continues. I'm an optimist. Let's hope this thing continues to keep going down. So look at it this way. You're going to take a snapshot of it, basically on Thursday. 2 weeks from this Thursday, we'll snapshot it again, look at it, and see what we're seeing. And we hope it's going to continue. We'll be able to go to midnight. And I suppose it's even possible it drops so much that we'll get 7 days in that it goes completely off. But that's how we're going to do it. Now, I want to make it clear, it can work the other way too. If at some point in a month or whenever we're going back up, we'll do it basically the same. We're going to do it the same way, and we're going to look at it, and we will have to move, quick then. But let's hope we don't have that. But look, this this virus, we don't know where we're going to be in March or April or May. I mean, we just don't know. No. Thanks for asking the question.
Next question is from Ashley Kirkland at WLWT in Cincinnati.
Hi, Governor. When it comes to age groups, this process to register for the 65 and older group has been a little confusing. A lot of people have called and emailed us for individuals to register. Is the state considering setting up a more structured process to vaccinate individuals like it did with nursing homes and will do with schools?
I'm not sure I understand your question. Could you tell me that again? Yeah, go ahead.
Is there something the state is considering to register people in groups that they associate with rather than their individual status based on age?
No, age is by far the best indicator. I mean, our whole goal is to save lives. And we know 65 and above, if tomorrow we had everybody 65 and above vaccinated, which we obviously are not going to do, that represents 87% of the deaths so far have been 65 and older. So it is by far the best predictor, bar none. And so that's why, we've picked off, we've done some things with other vulnerable groups where the medical professionals have told us they are very, very, very vulnerable at a high level of vulnerability. But those have been relatively small number of groups. Now, we're going back in school, not for that reason. We're vaccinating people in schools, quite candidly, to make sure that by March 1, we have every kid back in school. At least that's our goal. So that's a different purpose, but it's a purpose that we think is very, very, very important. The other group we have that we did by group is our medical professionals, but not every medical professional. We tried to focus and ask our hospitals to focus and everyone just on people who are really vulnerable, who are out there dealing with a lot of patients and people who are dealing with COVID patients. So those two kind of groups are kind of where we did go by group, but the best predictor and where we're going to do the vast majority of people is based upon age. And so, that we've set that at 65, and we're going to, as we say, work our way down. In a couple of weeks, we'll be to everyone who is 65 and older will be eligible, and we'll just keep doing those just as fast as we can do them, as much vaccine as we can get in.
Next question is from Marty Schladen at the Ohio Capitol Journal.
Governor.
Hi, Marty.
Earlier this week, Marty Makary, he's a Johns Hopkins professor, wrote a column in the Washington Post arguing that we should not be vaccinating people who've already gotten COVID and recovered. He said reinfections are very rare. The immunity appears to be pretty durable. And with such scarcity of vaccines, doesn't it make sense to get them into the arms of people who have no immunity? Have you thought about any of this?
Yeah, go ahead.
Yeah, Governor,
let Dr. Vanderhoff answer that.
Okay.
Yes, thank you. We've seen arguments like that arise periodically since the advent of the vaccines. But leading authorities, especially leaders in the field of vaccinology, have really not advocated for that kind of approach. The reality is that we have very predictable and very robust immune responses among people who receive the vaccine. Now, it is true that for a window of time after a person is ill with COVID-19, and that window is thought to be in the neighborhood of about 3 months, a person does appear to manifest some reliable and pretty robust immunity. Our concern really becomes about a waning of that immunity that we have much more confidence won't happen among those who receive these vaccines. So the CDC and leading health authorities continue to advocate for people to go ahead and get the vaccine when they're eligible, provided they are outside of their isolation window and that they are fully recovered symptomatically from the illness. But they do say, if you want to wait until closer to that 3-month window, that's okay. You can do that.
Thank you.
Next question is from Molly Martinez at Spectrum News.
Hi, Governor.
Molly.
It's been a little over a week since you've worked with this new administration, and I'm curious as to how it's been from a governor's point of view and what difference you've seen in dealing with the two administrations when it comes to this pandemic.
Well, we had a good relationship with the Trump administration. I think I've told you all that, you know, we had meetings once a week or so, very regularly with the vice president, and it was an hour and a half, sometimes 2 hours. So you had Dr. Burke who came out here. So it was a solid, good relationship with the Trump administration. The Biden administration started reaching out to us before they took office. So we established that relationship, and it's been a very good relationship as well. So good relationship, both cases.
Next question is from Tom Gallick at Gongwer News Service.
Hi, Governor.
Hey, Tom.
There have been arguments put forward by teachers unions in Ohio and nationwide that return to the classroom shouldn't be pegged to any singular date, but pegged towards all employees having their 2 vaccinations. I wanted to give you a chance to respond to that.
Sure. You know, Tom, we know so much more today than we knew in the spring. We know the power of masks. And we also know that Ohio children will wear masks and the teachers will wear masks and that school personnel will wear masks. The compliance has been virtually 100% in our schools. And what school superintendents and principals have been reporting to me for months is even when they have a child in class who they find out later has COVID, they are not seeing spread in that classroom. We were cautious and took that anecdotal information, but said, we need to study it. We need to do some tests. And so we had, I think, 7 schools spread around the state who agreed to be part of the test. And we did a test. And we did this through Ohio State University. I'm not the scientist, but basically, from a layman's point of view, here's what they did. They took people, if there was somebody in that classroom who turned out to be positive, they took the people around them who were within 6 feet, where everyone was wearing a mask, and started testing these kids who had been exposed. At the same time, they did a control group, other kids who had not been exposed. At least we didn't know they'd been exposed. The results they got back were almost identical as far as what percentage were positive. As I recall, it was 3%. It may not have been exactly 3. That's what I recall. So you had a control group that was 3%, and then you had kids who had directly been exposed, who we knew it, had no higher. There's also been several national studies done that showed the same thing. So what we know is kids who are in school wearing masks, we know that kids will do that. We know that adults will do it. We know that Ohio schools have done it phenomenally well. And we have scientific data that shows there's virtually no spread in that classroom because of that, even when they're within 6 feet, less than that 6 feet spread, as long as they're wearing the mask. Combine that with our efforts to vaccinate every person who wants to be in that school, no matter what their position. We want to give them vaccination. We're going to try to get everybody done in February, that first dose. Some people will get their second dose in February. And I'll leave it to Dr. Vanderhoff, but he can kind of tell you what one dose means. One dose is not complete, but it does have significance. So I think when you layer those protections on top of each other, what we know with the mask, what we know we've seen as far as in-school, in-classroom spread, which has not been much at all, and you add on top of that the whole idea of getting that vaccination, and in some cases getting the second vaccination, I think there's a lot of protection there. I don't know, Dr. Vanderhoff, if you want to add anything to that.
Governor, I think you said it very well. I think it's important for people to recognize that masks really do work. And essentially what the Ohio schools COVID evaluation demonstrated, reinforced, and again has been further reinforced in school settings in other national literature is that those wearing the masks and those around the people wearing the masks can really have confidence in that approach. Of course, we continue to advocate for maintaining social distance as they can, as well as keeping distance, but the masks really do work. I'll also add that the governor's absolutely correct. The first dose of vaccine does have a substantial impact, and we can see that impact evident within weeks. Our second dose remains very important, primarily because it's a booster. And it is part of the important step with these two vaccines that we undertake to ensure that immunity will be long-lasting immunity. But that first vaccine does have a substantial impact.
Next question is from Scott Hallis at the Xenia Daily Gazette.
Hey, Scott.
Hey, Governor, how are you today?
I'm well, sir.
Good. Thanks for taking my question. Correct me if I'm wrong, but early childhood education teachers are not part of the group of teachers that are going to be vaccinated. Has there been any thought to including them in that group?
You know, we have looked at that. They certainly can make a compelling case to be vaccinated, as can a number of other groups. We tried to stay focused, as long as we have such a limited amount of vaccine, to the question of how we can save the most lives with this limited amount of vaccine. The other thing that our goal is, we've been very clear, and that is children K through 12, getting them back in school. So those have been the two goals that we have had. But certainly this, our early childhood teachers, our early childhood providers do a great job, and you know we'll continue to evaluate the situation as we move forward. But the scientific decision and the clinical medical decision was made based on the criteria that I just outlined, and that's where we are today. But we'll continue to look at this.
Next question is from Joe Ingles at Ohio Public Radio and Television.
Hey, Joe.
Hi, Governor. How are you today?
I'm well. Thank you.
We're hearing from people who have tried to get appointments for vaccines for family members who are 80 and above, but still can't get them. And the bottom line is there are a lot of at-risk seniors who cannot get scheduled for shots right now. The caretakers are trying to help seniors, but they're having to call multiple places trying to seek out vaccines. It takes a lot of time and it's frustrating. Why hasn't Ohio done more? Why haven't you done what some other states have done and provide a more streamlined process for people in this situation?
Well, Joe, some states, start kind of from the beginning, some states have decided to do a few big sites. We didn't think that was a good idea. It might have been the most efficient in some respects, but it didn't put a provider in every community, which is what we have done. Now, what that means is, of course, that people are scrambling. There's a scarcity of this. And so we looked at, early on, we looked at, was there anything on the market that we could buy, a central kind of scheduling that would go in and understand there's no uniformity here. So we've got a pharmacy here, we got a pharmacy there, we've got a hospital there. They all have their own scheduling. So what we're in the process of having developed and are developing, and we're not ready to roll it out yet, but we hope in the next several weeks to be able to do this, is to have a central scheduling place where people can go online and then put in their zip code or put in their county. It will come up places where you can sign up, and then it will take you directly into those locations. So that will be a lot easier. Now, Joe, it doesn't solve all the problems. It makes it easier to navigate for those who can use a computer and those who have a computer and those who are tech savvy at least enough to do that. So we think it will be an improvement, but we know that we also have to reach people who can't navigate that. And so some of the doctors who are doing this, some of the other providers, you can call them, not all of them, but some of them have a phone number that you can call. We are also doing outreach, as you heard me describe. We have started that, going into churches, basically going into congregate care, not congregate care settings, but elderly housing and places where, again, people are already there, where we can go into the lobby and set something up and make it more convenient for them to get the vaccination. And we're looking at other things to do as we go forward. But we hope in the next few weeks, we'll have a central place where you can go. If you use your computer, you can go in and tell where you live, and they'll tell you, here are the possible places, and then you can go into that web page directly and go from there. So that's coming.
Next question is from James Pilcher at WKRC in Cincinnati.
Good afternoon, Governor. What is the state's efficiency rate when it comes to delivering the vaccine, i.e., how many doses has the state received versus how many it has given out? Kentucky says its rate is 88%. What is Ohio's efficiency rate for vaccine distribution?
Yeah, these numbers are always difficult to totally tell, and let me just explain why. First of all, as we've said, we put a lot into our long-term care facilities because we felt this is where we have the highest deaths. We have more long-term care facilities than virtually any other state in the union, and so we had to set those aside. So if you, as I described earlier today, we're happy we did it. It was the right decision, but those are only drawn down not by us. Those are drawn down by the pharmacy partners that we have, even though they, quote, are credited to us as we have received them. We haven't physically received them, and we can't control them. And they're only drawn down by the pharmacy basically as they need them to go into that nursing home or into that congregate care setting. If you take those aside, we try to come up with a number on Sunday as a good day. And we use Sunday because shipments are made in here on Monday, Tuesday, Wednesday, and Thursday. We asked people to vaccinate within 7 days. We'd love for them to do it in 4, but we've given them 7 to do that as far as scheduling. So if you pick Sunday, it's easier. You're not getting that new batch in yet, but you're really not finished with the previous week's batch totally, particularly for those who got it might be on Wednesday or on a Thursday. I believe that the director told me that as of last Sunday, we were at about 85%. So I think that's where we are. And, some of it had not cleared the data that we knew stuff. It may have been, it's a day or two behind, lagging on what is the input, but I think it was around 85%.
Next question is from Justin Dennis at mahoningmatters.com.
Hey, Justin.
I think we're having issue with Justin's audio. We'll come back to him and we'll go to Jeff Reddick at WSYX in Columbus.
Hey, Jeff.
Good afternoon, Governor. I think it was last week that you said the state may have to slow down the vaccine age eligibility because of lack of supply. Does the situation or situations you've outlined today having more vaccines eliminate that? And why or why not?
No, it really doesn't eliminate. I'll tell you what we did. We try to listen to people. We went out and talked to doctors. We talked to other people who are providers. And they said, look, you've outlined the sequence. If you change the sequence, people are going to get more confused. And they told me, we're already having people who are 65 calling and can't understand why they can't get an appointment. So some states, as you know, went directly to 65. We wanted to give our older Ohioans a little head start, but we understood that all 80-year-olds would not be done, 80 and over would not be done by the first week. It was mathematically impossible. So we've staggered this. We announced how we were going to stagger it. I think it would cause more confusion for us to change that. So, this week we're at 75. Next week it'll be 70 and older, and then the week after that 65, and then we go from there. Now, there's nothing to stop any of the providers. I know some of them, for example, during the first week when it was 80 and above, kept a list of those who are 80 and above. There's nothing to stop them from prioritizing those individuals who are 80 and above. And they can certainly continue to do that. I know some of them are doing that just because of the list that they already created. So no perfect way of doing this. It's confusing to people. We said, we announced 65 and over is going to be our priority, but we're going to start at 80. And then some people, of course, heard 65. So we've outlined it. We want to be consistent. We're going to continue to do that. And we're going to continue to pump as much as we can into those 65 and older, or whatever week that we're on. Eventually, in a couple of weeks, we'll get to 65 and older. So we could have paused it, thought about it, frankly, made the decision after talking to people who said, no, this is going to cause too much confusion. You need to continue to stay right with what you said you were going to do, because we had some providers who were scheduling based upon that, out a week, 2 weeks, based upon what we'd already announced.
We'll go back to Justin Dennis at mahoningmatters.com.
Hi, Governor. Sorry about that. Can you hear me now?
Justin. Sure, I can hear you.
You talk about the scarcity of the vaccine. What happens when a school that is struggling to get the majority of its workers vaccinated because of that scarcity has to close again because of an outbreak? What makes you confident that you can effectively get vaccines for both groups at the same time? And how will you know whether you're succeeding at both rather than failing at both?
Well, if I understood the question correctly, you can tell me if I got it wrong. My understanding of your question is the school goes back, everybody gets vaccinated. Who wants to get vaccinated? Then the school has to close, for some reason. They've got an outbreak and they can't put enough teachers in the classroom or whatever it is. Whatever happens, happens. I mean, we hope that doesn't happen. We hope by vaccinating a number of their professionals and all the people in the building that they'll be able to keep the school open. But we know that may not happen. And so the school is going to do the best it can do. And we hope that, armed with this extra help through the vaccine, that they will be able to keep the school open.
Next question is from Kevin Landers at WBNS in Columbus.
Hello, Governor.
Hey, Kevin.
A viewer called into us who said that he has severe asthma, and he tells us he was turned down for the vaccine because he wasn't hospitalized this year. People are really frustrated by this, and I'd like to know what your response is and how you plan to fix this. And also, in terms of schools, if a school district doesn't get the vaccine by mid-February, they wouldn't be able to open by March 1st. Is it possible that schools could open if their employees just have one dose? Thank you.
Well, sure, schools, I mean, look, Kevin, we've had a lot of schools who have been open the whole year. And they've toughed it out. They've done it. A large number of schools that have done that. Frankly, our concern is for the schools that have not been in and students, not for the schools, but the students. I mean, this is all about kids. And my concern is, and shared by mayors across the state, shared by a lot of educators, a lot of parents, really imperative to get kids back in school. So there's been a real, that's our real push, is to get kids back in school. And that's why we're doing it and offering the vaccine, we think. Plus, as I said before, knowing what we know today, we just know more than we knew in the spring. We know more than we knew in the fall. And while schools were making decisions at that time about not being in person, they didn't know, and we didn't know, how powerful masks were. They didn't know, and we didn't know, that kids all would wear masks, and the teachers would all wear masks, and everyone would wear masks, even down to small kids. They didn't know that we would do a study, and the study would show that there was no spread in the schools, in the classroom itself. So we know much more today. That should give people a lot more confidence to be able to go back in school, even if they've been out all year. Plus, we give them the vaccine. Now, you had a second question in regard to severe asthma. And I'm going to go to you, Bruce. I'll let you take that. But let me just, again, say one thing, and because you ended your question very understandably with what are you going to do about it. There are a lot of people that should be vaccinated in the state that can't get it today because there ain't enough vaccine. Our job is to try the best we can to make decisions where we can save the most lives, where we can get kids back in school, and we can protect our health workers. And we pretty much have done it with the health workers, not totally, but it's pretty much done. We're going to work on the schools the month of February. And we're going to continue, as we do those things, we're going to continue to focus on saving the most lives. And the best predictor is age. Now, as far as the asthma question, Bruce, I'll let you answer that, and why the requirement in there is to have been hospitalized in the past year. And let me just say, I have asthma. Years ago, I was hospitalized for asthma. I've not been hospitalized for many, many, many years. It's just a fact. And that doesn't change the answer one way or the other, but I guess it's a disclosure. And I'm going to let Bruce, who's the expert on this and who helped put this together, tell us, why severe asthma and why it's defined as hospitalization.
Thank you, Governor. It's a very, very good question, and it is one that the medical experts with whom we worked gave serious consideration to. As we were looking at the list of severe medical conditions, congenital and developmental medical conditions, we were mindful of the CDC's risk of high-risk conditions that also had high levels of evidence around them. And the focus of that was really on severe respiratory disease. That severe respiratory disease can include some people with asthma, but it is, I would describe, the much more severe end of the asthmatic disease spectrum. And as we spoke with medical experts around the state to identify the best way to equitably identify those individuals, there was pretty strong consensus that identifying them by virtue of the fact of requiring hospital level care, which is a pretty good indicator for most conditions of very severe illness, we landed on that definition. There is no question when we are talking about medical diagnoses and using medical diagnoses as a basis for getting in line for vaccination, that it is challenging, that there can be subtle differences between patients. But given all the considerations I just described, this seemed to be the most equitable way to approach that question.
Next question is from Chelsea Sick at WRGT in Dayton.
Hi there, Governor.
Chelsea.
So we are also receiving several calls and messages from our viewers concerned about the unemployment backlog. They say they haven't received the benefits since the end of December. The first of the month we know is less than a week away. Some of these messages are saying people would rather be in jail or dead than dealing with the system. They say they reach out to the Department of Job and Family Services and just aren't getting the answers they need. We know a target disbursement date for some of these benefits is expected to be January 31st, but that's not guaranteed. What is your message to them? What is your team doing to work on this program and help make sure people get their money?
Well, Chelsea, we've talked about, the things that we've done before, but I've said very clearly, if I'm unemployed and I don't get my check and state doesn't get it processed, there's no excuse that matters to me. So, for anyone who's having that trouble, I apologize to them. It has not been what I wanted to see at all. It's not been what the directors wanted to see. We can talk about not being in the cloud. We can talk about going from 400 people to, I think we're going to be at like 2,500, 3,000 by March. So, a lot more people have been put on. But again, that doesn't solve the problem. It's not a question, as you know, under the federal law and state law. It's not just a question of somebody applies, you write a check, and it just continues on and we go on. There has to be a checking in every week. There's a check that has to take place every week. The initial analysis have to be done. We've also been hit very hard in regard to fraud. As we pointed out, Fran and I both, I think the Lieutenant Governor as well, got notice that we'd applied for unemployment, and so kind of crazy. We obviously had not applied for unemployment, but it is clear to me this is a huge department, and I think candidly, state government needs some help from the private sector. We need help from private business. And we hope to have an announcement within the next few days about that help. So we are reaching out and we'll have something to announce very shortly. Again, that does not help if you're not getting your check, but you asked what we're doing. And I've looked at this and really came to the conclusion that this is a massive job. We have to have someone from the private sector to come in to handle that, to take that portion of a very, very large department. To take that portion over and to really oversee that and bring in that kind of expertise.
Next question is from Laura Hancock at cleveland.com.
Hi, Governor. I wanted to touch on something you said last week when asked about why second doses aren't reflected on the vaccine dashboard. You said it would be soon. It's still not there. So I was wondering about that. And then I was also wondering, the CDC this morning has data. Well, they have it every day, but this morning I checked and it shows that Ohio's vaccine rate per 100,000 residents is the lowest compared to all 5 surrounding states. What do you think that is, and what can we do to get better?
Well, I've kind of been over this before, and I know it's very difficult, and I don't explain it maybe very well. We are number 2 in the nation in vaccinating people who are in our nursing homes. We're very proud of that because that's where we lost 54% of our deaths. We are a state that has per capita, I think, the 3rd highest nursing home number in the nation. So we're having an abundance of nursing homes and abundance of beds. So when I looked at this at the beginning, I said, what we've got to do is go after those nursing homes. We have to do it. This is where it's been agonizing, despite testing and doing many different things and great efforts by nursing homes. We've seen 54% of our deaths come out of nursing homes. So we made the decision to go with nursing homes. The federal government says, okay, you can do that, but you got to bank all these. And a good number of them are still banked. So they show us as getting them, but we have not got them. And the only time they're pulled down by pharmacy companies. So until and as I outlined also further, we're not only doing nursing homes, we're not only doing assisted living. We made a decision, and I don't think most states have, to go deep into our congregate care settings because we knew these were the most vulnerable people. And we knew that these individuals lived in a setting where it was a high rate of spread. We have given the local health departments 5,000 of these locations in the state. But anyway, getting back to the pharmacy program. So we had, 350,000 roughly set aside, and there's many of them are still, most of them still out there, and we're slowly drawing them down. So those all count against us, but it does not count towards the vaccination. So, we are working very hard. As we said at the beginning, frankly, we had some providers that were not moving fast enough. I've got one or two more to call today. Our goal is to get out of every place that has extra vaccines that they're not putting in people's arms. We need to get them in people's arms. And so we're going to continue. We're going to continue to do this. We're in this for the long haul. Our goal is to vaccinate the most vulnerable people as we can, to pinpoint that vaccination and to move forward. So, we can look at all kinds of numbers. I think the ultimate number is how many lives are we going to save? And, as I look at the numbers, I can guarantee you that, I look at them every day, and we look to see where we can get better, and we're going to continue to do that.
Governor, last question for today will be from Danny Eldridge at Hannah News Service.
Hello, Governor. So you said nursing home staff is only about 45 or 50% getting the vaccine. So how responsible is it for the state or for nursing homes to allow so many people to refuse the vaccine when they're around the most vulnerable citizens?
Well, we have not imposed, and I don't know any state, maybe some states have, I'm not aware of any state that has required vaccines. That's a big step if we take that step. We are running about what other states are running as I talk to fellow governors around the country. So nursing homes have the ability to continue to try to educate their staff. We will come back and we will vaccinate new residents who come in, new hires who come in, and we'll even old hires if they want to be vaccinated. So we're going to continue to work to get those numbers up. It's very important. Most important thing is to make sure that the people who are the most vulnerable, and that is the residents, get the vaccine. And so we're going to continue to push there, and we're going to continue to push in regard to those who work there. I think we're out of time, and we'll see you on Thursday. Thank you very much.